My name is Una Osili. I am the Associate Dean for Research and International Programs at the Lilly Family School of Philanthropy, the world's first school on philanthropy at Indiana University. I'm also a proud daughter of the African continent, and I'm here in my many capacities. I want to start by reflecting as I came to the conference this morning. I was very excited, actually, just because I think we live in a new era. We call it the age of Wakanda. It's the age of possibility. It's also the age of transformation in every single sector. It's not just healthcare, but it's across the continent. We're seeing signs of transformation. Things that were not possible even 10 years ago are becoming possible with technology and many new resources on the continent. Black Panther shattered myths about what Africans and people of African descent can do, grossing more than $1 billion in its first few months out globally. So I think we live in an era where Africans are starting to find solutions, unique solutions to African problems. And nowhere do we see this more evident but in the health sector. So that's the big picture. Now let's take it down to the personal. Growing up in Nigeria, I saw all the challenges that we're talking about today: maternal mortality, infant mortality, and even the chronic diseases like malaria. Our own brother, my only brother, we have a family of 4 girls and the last is a boy. When he was 3 years old, he was diagnosed with chloroquine-resistant malaria. He had 3 blood transfusions. Everyone was about to give up on him. My sister and I took turns. I was only 12 years old at the time, at the hospital, spending the night with him. So I saw what challenges pediatric patients face on the continent. Fortunately, he survived. He went to Stanford University, his undergrad and his master's degree. Not every child has such a successful story. And then finally, as I think about the research that we have today, investing in health is a game changer. We have evidence that spending about 30 cents or less on deworming medicine not only improves children's health, but improves their educational outcomes and their life outcomes and their labor productivity. So if we're looking for game changers today, and I think we are, there's no place to look than in the health sector. I'm really delighted and honored to introduce this very distinguished panel. I'm going to start with the person closest to me, Dr. Nneka Laura Mobison, who's the co-founder and CEO of MD.com, a new company that's finding innovative solutions to healthcare across Africa. I wish I had time to go into her bio this morning. If you have time, please look. She's literally the most educated person I know. She has degrees on every topic you can think of, and she's here to share that breadth of knowledge with this panel. So I'm honored, delighted, and just excited to have you here today. Sitting right next to Dr. Mobison, we have Serge Ibaka, who is also another distinguished son of the African continent. He hails originally from the Congo, but plays at the highest levels of sports and entertainment in the world with the NBA, playing with the Toronto Raptors. He's been a member of the NBA for more than a decade. But let me just take it back by saying that not only has he achieved success on one of the highest levels that you possibly can, he's chose to reinvest in his own community, starting with health initiatives in his own hometown. He's currently building a children's hospital and learning from everyone around him how to do that. So thank you for being with us today. The next person on the panel, Dikembe Mutombo, probably needs no introduction. He is also one of our most distinguished sons of the African continent, started the Mutombo Foundation, has helped not just improve health in the Congo, but across the African continent, focusing on chronic disease. And then our last, but not the least, by no means, panelist, Ellen Inger, is also on the front lines of improving health across the continent as executive director of the END Fund. Her organization focuses on neglected tropical diseases. I also want to give her a shout out because she's also a celebrated author with a new book about extraordinary stories in ending tropical disease. So Ellen, welcome. Okay, so we're going to get started. This is a great panel. I don't want to spend too much time speaking. I'd rather have them share their stories. I want to go around very quickly with each of the panelists to ask them to just list one accomplishment of their organization. Just talk about the organization and what work you're doing that's truly transforming healthcare on the continent. So we'll start with Dr. Mobasin.
Thank you so much, Una. Really appreciate the introduction. It's an incredible pleasure to be with you all today. So MDOC essentially leverages technology, quality improvement methodologies, and behavioral science to optimize the end-to-end care experience for people living with what we call continuous and chronic health needs across the continent. Our focus countries are actually Nigeria and South Africa at the moment. So what does this mean? Premature mortality from chronic diseases like diabetes, high blood pressure, are actually are growing at a faster rate in sub-Saharan Africa than anywhere else in the world. Yet, we always hear about Ebola, HIV, TB, malaria. We're not talking about what's actually driving these rates across the continent. And so MDOC, we essentially founded MDOC because of a personal experience where my father, an MIT-educated professor, unfortunately died from complications from a massive stroke that he had at the age of 53, largely because he didn't have access to a team of providers to support him in managing his uncontrolled hypertension. So what did that not do to just him and his family? What did it do to a continent, to a country, the Nigeria, where he was trying to transform the technology landscape? It more or less destroyed his dreams and more or less destroyed the impact that he could have had on Nigeria and our continent. So it's not just thinking about it from the individual perspective and at the health perspective, but what it's doing in terms of economic productivity. So for us, we essentially are, from an accomplishment perspective, we connect individuals who have high blood pressure or diabetes and also coexisting depression, because that often is linked with chronic disease, to a virtual care team through a mobile phone. So think not just a doctor, but a coach, a nutritionist, a pharmacist who really support them in defining their health goals and achieving lifestyle modifications as recommended by WHO. From an accomplishment perspective, we look at numbers. We always look at numbers, right? Because without data, we're nothing. And so for us, we've been able to show that in a cohort of people that we're working with to focus on hypertension, we've been able to, one, from a lifestyle modification perspective, reduce 5 to 10% of their weight in the overweight population in about 80% of our population to date. In addition, we've been able to drive control of hypertension in about 60%, and we're pushing that number up. So with that, what does it mean in terms of impact for our continent? If we can achieve this at scale, hopefully we'll be able to drive sustainable change.
Serge, what about you?
First of all, I just want to thank you guys for being here, and I'm very excited for today, because being here and also being next to my big brother, it's kind of, I was telling his wife today, and my big brother was here. He inspired me in a lot of ways, on the court, off the court. I remember growing up in Congo, when I learned about him, he was from Congo. And I was like, wow, I didn't believe one day, Congo could have an NBA player. And he was one of the first one. And because of him today, I have my foundation. I started my foundation 6 years ago because of him. And because of him, I'm one of the best shot blocker in the NBA because of him. Wow. That's on the court. And because of him, today, I'm having a plan with my team, with my foundation, to build a children's hospital. And I'm starting to work with UNICEF 4 years ago. And today I'm working with Global Citizens. We're focusing on health and education. And sharing this moment with my big brother here, it's huge for me. It's like dream coming true. So with my I lost my little brother 6 years ago. He was like 2 years old. I lost him in Congo. That's where I got a motivation to decide to say, you know what, I have to do something about this. I have to do something about this, because where I come from, we see a lot of kids, a lot of children die with small disease, very small disease. Sometimes it's like we don't know, from water, and then it's kind of sad, and then it's the reality, and it's my job, to stand up to do something. So, and of course, for inspiration from my big brother, I say, you know, I want to follow his steps. And then he has his hospital too, so I'm just trying to learn a little bit and learning from him. But I told myself I had to do something. So today with my team, Serge Ibaka Foundation, and we are working on that. And you know, I believe in God, and everything is going to happen because things happen for a reason. And I was choosing to be here for a reason.
Yes, excellent. Thank you. No, so you can see the power of example here. Okay. Dikembe, can you share with us what the impact has been so far? We all know your amazing story as a pioneer on the field, on the court, and off the court as well. Can you just share quickly what your foundation does and what your accomplishments and successes have been to date?
Thank you so much for having me at the panel. My story can be a little bit long, but I'm going to make it short. 20 years ago, I have a vision to start a foundation, my wife and I. So we started the Gamechanging Foundation, which a plan was to build a hospital, then build a school next, and maybe build a basketball court. And 10 years later, we was able to build the first modern hospital in Congo, which has been in operation for 11 years. You have treated almost more than 500,000 people. We're so happy with the work we are doing. You know, growing up in the Congo, as Serge said, you see death in a really young age since you were born. You see all the kids are dying, your friends, your neighbor. So it's nothing surprise to us until today. The disease continues to take lives away from so many people. We are working hard to reduce the mortality. We all understand that we're not going to end the death in Africa. You know, death is part of our life. But what we are doing, we just want people to live much longer. By the work we are tackling now is what is happening to our mother and sister, auntie, grandma, who are dying from some preventable disease. The best example right now is the cervical cancer. The treatment that costs only $15 to treat it. But you see the number of women in Africa who are dying from this disease continue to rise. The breast cancer is on the rise right now in Africa. Nobody's talking about it because it's like a taboo. You know, mom and sister and grandmama are dying from breast cancer. They're hiding themselves. Nobody wants to know in the community what they're dying for. So 2 years ago, I took a challenge to create a cancer center at the hospital. So right now we are attacking the breast cancer, cervical cancer, fistula, all the problems that the women are facing right now in Africa. And I think we cannot do it by ourselves. And we didn't build the hospital by ourselves. We built this hospital with the support of so many organizations, including the NBA players. So we need more support. You know, nobody in this panel here who are sitting here with me today can do the work that we are doing by ourselves. We need all of us to engage. You know, in Africa we always say that it takes a village to raise a child. So if we're going to change the continent, it's going to take all human resources of the continent, all of us, to put hands together to make a difference. You know, Madiba taught us about it. And I believe we can do it. So it's always good when people see me, they say, Dikembe, good job. Good job for what you and your wife is doing in the community, making a difference. The thing is, what can you do for us to make sure that what we are doing in the community continue to be sustained and make a difference? So,
Thank you,
Phil. Thank you.
Ellen, maybe tell us a little bit about the End Fund and the work that you're doing and why it's transforming the continent.
Oh, I'd be happy to. I am struck for a moment, though, hearing the stories of my panelists before me. Dikembe and I met almost 15 years ago now, and I was working for Operation Smile at the time, working on cleft lip and palate, and he came to an event that we did in Los Angeles. And what I remember then is we were sitting around this like gala table, squished together with way too many people at one table, and hearing the stories of people's lives transformed. And Dikembe was like, we need to do more. We need to do more. Where are the paperwork? He's grabbing everybody's pledge forms for like sponsoring more children. And at the time you had in your pocket the hospital plans.
Yes.
And it was still an idea. And you said, I want to do this for my mother. I want to do this for my country. And that just beautiful sense of seeing how I've seen you nonstop over all these years continue to fight and have more of an impact. And I love this Stephen Covey sort of visualization about there's our circle of influence and our circle of concern. And so many of us are spending energy on just being worried about a lot of things in the world and having anxiety about all that we might not be able to influence. But actually, if you put your energy into your circle of influence, your circle of influence will grow. And I just love seeing this transformational journey of so many philanthropists in this room. It's been beautiful this year in particular. But the African Philanthropy Forum, I was there when it sort of hatched as an idea at the Global Philanthropy Forum, and to see now the stories years later of how much impact has happened and who has met over time. So in some ways, I can talk about the N Fund because we're focused on combating neglected tropical diseases here in Africa. They affect 600 million people that should be receiving deworming medicines or treatment for trachoma, lymphatic filariasis, and other parasitic diseases at least once a year. But I also think about, when I think about what's been the impact beyond, it's amazing. We've helped support just dozens of community organizations and governments to scale treatment. Last year we supported treatment for 100 million people, and through partnerships have scaled treatment to hundreds of millions of people on the continent. But actually I feel like the profound change and impact has been in the community of people that have come together around the issue. And a learning community of philanthropists from the continent, internationally, community health workers, people who are suffering from the diseases themselves and helping them find voice and story. And neglected diseases is sort of a strange term. We both know Peter Hotez, who came up with that name, neglected tropical diseases, partly because nobody could pronounce the names of the diseases. And so it's like, we can't advocate for it if no one can pronounce these diseases. Let's put under an umbrella neglected tropical diseases. And it actually helped raise with advocacy. But I still think that there's so much more attention needed. I think that we're so proud of being able to scale treatment and work together with local partners. But some of the stories that I've heard in this room, when people say, oh, deworming. Actually, I was dewormed as a kid by my mother. And we didn't wait for a treatment program to come to our town. The week before Christmas, everybody got dewormed. Or before school started, we went and dewormed everybody in the family. And to me, I think that impact of who here was dewormed as a kid? It's interesting because I think about that as that's sort of a middle, upper class African story of being dewormed in your own family, in your own community. And I think, how can we push that broadly of actually not only waiting for treatment campaigns, but saying it's the sort of responsibility of mothers to engage their own kids in just treating. When I saw Lord Hastings here on the first day, he said, oh, you didn't bring your worm jar. So maybe that's another impact. I've sort of gotten known for bringing this jar of 200 roundworms, which is literally this big, which is the number in a belly of a child with a moderate level of infection. And each worm is 8 to 12 inches long. So if you can imagine a kid with hundreds of intestinal worms, that's hundreds of millions of Africans who are at risk of that disease. And it's not just, a few worms is no problem. Worms have been shown to reduce school attendance, to reduce cognitive development, to reduce, just to increase the amount of stunting. And then over time, we were talking about this before, the study that Michael Kramer did as an economist through that lens of looking at randomized controlled trials of if kids are dewormed, there's often in the economic productivity is 30 to 40% more compared to those kids that weren't. So there was a wonderful study done on if the deworming targets and NTD targets could be met in the next 5 years, Africa could gain $52 billion in its economy by 2030. And you don't think about that when you think about just, an annual deworming pill for kids. So I think that's...
Okay, we started this panel with, this is a new era in African development. This is the age of Wakanda. This is Africans finding solutions to African problems. And I just want to ask Dr. Mobasin to quickly comment on her idea was an African-grown solution. Are there challenges that you've encountered or successes along the way? And also, what advice do you have to other health entrepreneurs out here who are thinking about going into it? We have some examples here, but just what have you encountered in that African solutions? Any specific perspectives that you bring to the problem?
Sure. Thank you. I don't need the mic. So I'm a relatively young, I guess, entrepreneur, not age-wise, but in terms of being out there on this panel. So we've been doing this for 2 years. So essentially, I left my job as the head for Africa for an international NGO, where when I was with the NGO, in 3 years, I was able to grow our operations from 3 to 13 countries. I was able to easily raise $30 million, and we were able to demonstrate impact in terms of saving women's lives in particular, women and children's lives, in the hundreds of thousands. So then fast forward to me then now becoming a local African entrepreneur, a local African health entrepreneur. And I say health because honestly, I'll be very candid. I don't think that we are pulling our weight when it comes to health on this continent. We look at it as a cost, we don't look at it as an investment. And we are hurting ourselves every single day, the more and more we keep on focusing on it as a cost. And so it's been an incredible challenge for the last 2 years. So, as I said, easy to raise that money, and then all of a sudden I'm a local African entrepreneur. I'm trying to get people to care about diabetes, about high blood pressure, about mental illness. In a continent where we don't even want to acknowledge, as my panelists have said, that we have disease, that we have problems, that we have mental illness. And I just, permit me for just a second to actually just acknowledge, and I know this was done yesterday, but I really feel I have to do it, to acknowledge the passing away of Professor Bongani Mayosi, the Dean for Health Sciences at the University of Cape Town. For those who don't know him, he was honestly one of the most eminent Africans in healthcare on this, truly, in the world. And he made a way for so many Africans, for so many people. He was a top cardiologist, he was a researcher, and to be in that position in this country really underscores what he had to go through. A brilliant man who at the same time was kind and was about collaboration and support for people like me. And I also highlight him because it's also important to also recognize how he died. He died by suicide at the age of 51. And as Africans, we don't like to say that. It's very un-African of me to say this right now, but I'm saying it because I think that if we want to transform our continent in healthcare, if we want to say that we've revolutionized healthcare and that we don't have the world's worst indicators across the board in healthcare, then we have to be open, then we have to invest, then we have to support our local African entrepreneurs out there, people like us who are trying to do the work. For me, getting $5,000, $8,000, after I was able to raise $30 million was a miracle, okay? Just so I can put it out there for you. And to be frank, I mean, the funders that we've had are all foreign. The support we've had has been all foreign. And I'm grateful for every cent that we get to support us. But we've largely had to bootstrap. My co-founder and I have had to bootstrap. And we're trying to do the best we can. We're trying to leverage evidence-based research. So we look to get support from our African researchers, who are very few, but guess who wants to support us for free? Westerners, okay? When we now try to learn from others so that we can do this and collaborate together, who provides the support? Westerners. So there's something that's got to change on this continent in terms of support, in terms of collaboration, in terms of not working in silos and stopping to worry about ego, but think about the solutions that we need to address and that we can address together.
Dr. Mobasin just raised a point that I want everybody to understand. Across the board, whatever health indicator you're looking at, whether it's maternal mortality, cancer, deworming, African countries taken together are usually at the bottom of the list. So we need to change that paradigm. I want to talk to Dikembe as well as Serge. You've been able to bring on partners to address these issues. Building the hospital did not happen on your own. You had lots of partners. So perhaps you can just reflect a little on what was that journey like? How did you bring those partners along? And what can you share in terms of lessons learned along the way, building these types of partnerships and collaboration?
I think thank you for bringing up this issue. Thanks to my sister for bringing it up, because during the AIDS crisis in Africa, there's a doctor in Botswana said that when there's a problem affecting one part of the community, it's becoming a responsibility of everyone living in this community. But Africa is facing so many crises, especially when it comes to healthcare issue. And our community are now responding, especially those who have the means to help the community get better. What my family and I have done, and what we have done is we have invested in our community so people can have a better life. Because we believe that we do have a better life. We live in America, we live in a better society, but when you turn the TV on, you see death after death, and that will push us to go and make the difference that we are making. But we didn't do it with ourselves. We did it with so many friends, but all of those friends that came along with us, they came from a Western society. We continue to have a hard time to identify scientists, organizations in the continent that can work with us, because a hospital is a huge institution. You need a doctor, you need a biochemistry, you need a pathologist, you need an accountant, you need an administrator. It's a big company. People always think a hospital is just a medical center. It's a big company because you need an administrator, you need a financial advisor, you need a CFO, you need everybody work there. You need a driver, you need a paramedic from the ambulances. So you need everyone that you can get in the society. They are part of the hospital. Those are the challenges. But for us to move forward, we're still going to America and Europe. Now we're looking even at Asia for help. My thing is that we Africans, we need to find a way to come together. You know, we have to find a way to be unified and go and fight and to solve some of the problem. When someone is in a community, want to make a difference, want to make the community better, that person needs the support of the community. But what we are facing now, our home government targeting you because you're trying to make a difference and you're making them look bad. Because I heard that all the time. Hey, Mutombo, you're doing too much. Excuse me, I don't need nothing. You're supposed to applaud me. You don't have to tell me that I'm doing too much. Or you kind of embarrassing us, man. You're doing too much here. Those are the things I hear all the time. But they cannot stop me. Because what I'm doing inside, what is my family is doing, is all from God's will. And it's impossible for somebody to say.
Alan, we talked about this briefly earlier today. We talk about collaboration and partnerships all the time. It's become almost a cliche in this health space. But you've been successful at brokering partnerships, very unique ones, with governments in some countries, working across ministries in some cases, working with other NGOs, other philanthropists, collaboration at a small scale, but also national, regional, and international partnerships. Perhaps you can just tell us a little bit about what that looks like from your perspective, the challenges, and how you've overcome them, because these are real challenges that everyone has mentioned already.
I'm struck about this conversation of Western philanthropy and African philanthropy and where does everybody fit. And sometimes it's easy to feel very uncomfortable as a Western philanthropist, even on a panel like this. But I'm struck by, even when it's uncomfortable, if you've dedicated your life to improving the lives of others, to reducing suffering in the world, to me that's not a Western question or an African question. And the more that we can say, pretty much most of us here at this conference right now are global citizens, and we've taken our identity and our influence from so many different places. And when the End Fund was founded, it was founded by philanthropists from the Middle East, from Europe, from the US, yes. And the first discussions were, how can we make this an African institution? If we're going to focus on Africa, how can our donor base be African, our advocates be African, our board be African? And on my second day at the job, I was at the Global Philanthropy Forum and met the Strive and Tsitsi Masiyiwa, and Strive was like, oh, I'll donate to you. Absolutely. Sent me an email the next day. And I was like, oh, this is going to be easy. Getting Africans involved in this cause is going to be just easy. All we need to do is catalytic and raise awareness, and it's going to just be owned locally. And that's really, really hard, actually. And I think that what the rhetoric is sometimes about who should have what voice and what place and on what panel versus just seeing suffering. I mean, one of our great partners here today is the Helmsley Charitable Trust, and nobody was funding anything in Angola. You know, we're like, Angola should have, you know, they've got oil, they've got money, that's got some of the worst health indicators on the planet. And so, yeah, okay, to help millions of people's lives, that has been a partnership with the US philanthropy, and it's made dramatic difference. Or we're talking about a partnership now where in 100,000 people in Ethiopia will go blind if they don't get this simple trachoma surgery. I don't think those people should have to wait for all of this to be figured out. Now, on the same opportunity, I feel like my most amazing counterparts and people that I learn from are Africans trying to solve African problems. And so I'm like, can I please stay really, really close and learn and listen? And you know, we've got Tope Lawani is on our board now. He's a Nigerian who co-founded a large private equity firm based in London, but he's like, I want everybody talking about these issues in the boardroom. We need to get African companies involved. And I think about that. You know, I think about someone here from Doctors Without Borders was telling me that here in South Africa, Doctors Without Borders is raising funds for their global operations, and 80,000 South Africans are annually are donors to MSF. Not just to South Africa causes, but to their global causes. And that intersection of partnerships, I think, between the West and Africans and us kind of figuring this out, this new normal together, while also, to me, I struggle because I think right now there's many African health budgets. Some countries, in the poorest countries, 50% of the budget is made up of external aid, which is not good. It's not sustainable. But you also can't just say, let's just pull that all immediately. That would be hemorrhaging. That would be a massive loss of lives. And so what is this responsible way to completely change our relationship around partnership and aid and business, I think is our generation's problem to figure out.
No, definitely. We need all voices at the table and all heads aligned in terms of solving these problems. Serge, would you like to comment briefly on that? Because you've worked in partnerships. Your work with UNICEF is a very good example of that. What have you learned about the power of partnerships to solve these health challenges?
First of all, I just want to comment about what my sister just said about health issue. And I think sometimes in Africa we forget about a health issue. It's very important, you know. And I think it's our job to teach our people about that, because I remember growing up in Congo. It's kind of funny, but it's not funny actually. Growing up in Congo, in my neighborhood, when somebody got acting crazy a little bit, and then people are gonna say, it's a family thing, it's voodoo.
Yes.
You know? So we call that person crazy, or that person, his grandmom or his uncle is doing that, or voodoo things. But now learning all those things, I think it's very like mental issues, you know, and we don't know about it. People be dying, people be acting crazy, and we put them somewhere where we don't know exactly what is happening, you know. So I think it's important for us, you know, to start teaching our people everything. The mental issue, it's very big problems, and they exist. It's okay. And, it's somehow people can work on them, we can help them. But, we need to start changing our mindset about those kind of things sometimes, like, voodoo, family things. And this is still happening till now,
Yeah.
And then going back to my big brother here, one of the big challenge, like he said, is, we have to come together and let her ego out and work together because, one of the big changes that is happening to me right now is with the government. It's always hard, Like you say, you try to do something to help, to give back, but it's always like, they think like you try to compete against them, you try to show off. It's always like that, and I think coming together, helping and working together and let how you go out there, I think that can make a big change, personally, I think, and we need that. So, I'm just, being with him, I'm trying to learn a lot of things, and I told my team, we had to go slowly, because sometimes we get so excited about doing things and try to change lives, but I don't want to do them the wrong way, So I have a big example of my big brother here, so I'm trying to make sure I'm doing something, and for many, many years, even when one day I'm not here, and they're gonna still be out there and help a lot of people.
Okay. We're going to turn it over to questions from the audience, so please start getting your questions ready. But before we do that, I just wanted to ask the panel to just go very quickly and say, what is one thing we could do today that would change the game on the continent? Just one thing, if you can think very quickly on your feet, as it relates to help. Maybe it's, what can we do to help pilots? What can we do
I
to
would say that it's just collaboration between
more collaboration?
between all the African institutions. I think there's so many organizations in Africa, but we are not working together.
Yeah.
We are not. We are
Okay,
not.
so we need to work together. Collaboration is a solution. Dr. Mobison.
I would say invest in knowledge. You heard Serge talk about Dikembe, right? Medicine, health, it's an apprenticeship, right? We learn from the people above. I'm a pediatrician. I learned from the people above me. We talk about the brain drain and we all laugh about it or we sigh about it, but we're not doing anything to create incentives for our physicians, for our nurses, for our allied healthcare workers on this continent to stay. And if we don't do that, forget about any investment. So that's, to me, where the investment is going to be a game changer.
The infrastructure.
Yes.
What about on the neglected tropical diseases, onchocerciasis? We didn't get to talk about it. What is one game-changing solution we could start now to think about?
The thing about neglected tropical diseases is that the treatments are available, and the pharmaceutical industry is donating about $4 billion a year. There's actually more treatment available that can be delivered. So I think it is about delivery, and in so many countries, if we had better delivery at the local levels through community health workers, that would not only help neglected tropical diseases be solved, but a whole range of health systems and health issues. So to me, scaling community health workers, paying community health workers across the continent would be a game changer.
Okay, perfect.
Another thing I want to add that our solution will come when we will include women in every problem that we are trying to solve. Because women are the head of the household, and they are the one who control the family mostly in Africa, almost 99%. And so if we give the power of health to women to make sure the kids are healthy, our society will be better.
So
and
investing
we need
in
to
women.
educate more women as well.
Investing in women. Perfect.
Yes.
Okay, Serge, one thing that would be a game changer.
I think like my big brother again say, I think like investing in women, we work together with them.
Yeah.
We need to accept them like women, they are a big part of us, of this continent. Because of them, that's why we're here right now. So we need to accept that and then work with them. And one of the big things is, work together. Together.
I think we have time for 1 or 2 questions from the audience. I hope some of you have your questions ready. I see some hands starting to come up. Yes.
My name is Monique Wasuna. I work with DNDI. I'm situated in Kenya in the Nairobi office. First of all, I'd like to thank the panelists for their insight into health and the wealth of experience. Big brother and small brother. Really, very impressive. Just experience. In 2003, when DNDI was created, they had the insight of going and working with communities and developing disease-specific platforms because of the neglected tropical diseases. And as Africans, for Africans, we created the Leishmaniasis East Africa platform. This brought together many scientists from African countries, ministries of health, drug regulatory authorities, because clinical trials is a highly technical venture, and you need a lot of training. Yes. And most of these countries did not have infrastructure. People could not stay, brain drain, people were leaving, there are no labs. The hospitals are smelling, there's nothing. So we came together and said, these are our people, these are our mothers, our brothers, let's come together, Kenya, Uganda, Ethiopia, Sudan, let's do something with the help of our northern partners, DNDI supporting. And it's unbelievable. We went into these communities and they were doing never had done clinical trials before, working in tents. I was horrified. First experience. I come from Kenya, and Kenya is okay. But in some of these countries, they were working in tents. You can imagine doing a clinical trial in a tent. Very hot in the day, very cold at night, and these people are hungry, and so start building the infrastructure. So cut the long story short. There's so much we can do together, because this was not us alone, but with people helping. And it helped Africans stay in Africa, do clinical trials, expertise that we needed. And really, we are in DRC, Congo, Big Brother, I know is involved in the Heart platform. So all these platforms were created. And I think the inspiration to the team here, we can do so much together. Mm-hmm. But I want to say that, according to my sister from END organization, really what drove us into doing these clinical trials, because for some of the diseases, for 70 years, there's no treatment for this neglected disease. Some of the industry are not making these treatments because these are poor people. They don't have money to buy their medicines. And so medicines actually do not exist in some of these neglected diseases. And that's how we come in to make the medicines for these people, because they're also people. And even if they don't have money, we can provide the medicine. And we can partner with the ministries of health so that we can make the medicines, change policy, and give the medicines to these people. But we work closely with END because we do the initial bit because there are no drugs, and then they can do the other bit when there are drugs. Thank you.
I want to just make a note on that this is such an important issue, I think, across many different sectors, that maybe I think about, I've worked a little bit partnering with like oil and gas companies, and they refer to, okay, there's upstream and downstream. And in the health sector, upstream would be research and development, finding new diagnostics, finding new drugs. But then this gap that exists between actually finding the new drug and actually getting it to the people who need it can be a valley of death, like a long, complicated process that actually never gets to the people who need it most. And so all of us who are able to work in the margins, work at this edge of, for us, we're like DNDI, as soon as you have a new thing that can target these diseases, we're the access and delivery platform that can help support a lot of organizations to do that. So I do feel like seeing things across the whole pipeline, from development, discovery to implementation, is so important.
There is so much to digest from this panel. I want to encourage all of you to take what we've learned today and act on it. We all need to roll up our sleeves. You've seen the size of this challenge, the millions of lives at stake. We can all do something. Support the medical entrepreneurs, support the entrepreneurs who are starting hospitals, the philanthropists who are putting their time, support the organizations that are working to end these diseases on the continent, support the researchers who are working on cures in their labs. There's enough for all of us to do. Let's come back to this table in a year from now and mark the progress we've made rather than outline the size of the problem. So thank you to the panelists and thank you to all of you.
That's really good.
Good job.
Thank you.